Hello, I'm Dr. Marty Harris, President of LABI College. So excited to be here with you today. LABI College is the oldest Hispanic Bible college in the country, and I've been serving as their president for 10 years. I'm also a research psychologist and clinical psychologist by training, and just so excited to talk about Latino mental health and the church today. I want to jump into the brain and brain development because I think it's real important to understand how the brain functions and is impacted by mental health and emotional distress. If you look at the images on the screen, you'll see two images. Both of them are from an imaging process called SPECT imaging, single photon emission computerized tomography. And what they do is they tag the blood with a radioactive substance and measure three important functions of the brain: how your brain uses sugar, oxygen, and how blood flows throughout the brain. And where sugar and oxygen in blood is not flowing, you're going to actually see functional holes in the brain. On the right, you'll see a normal brain, which has smooth activity around it. On the left, you'll see a brain with holes in it. In particular, this brain is somebody who suffers from opioid abuse and drug addiction. So it's a good model to see how the brain is damaged, if you will, by substances or other things that are going on in your brain. When your brain is depressed or anxious or stressed or suffers from severe mental illness like schizophrenia, it too will also have functional holes in the brain. So it's important to make the connection between the mind and the body in this regard. One of the things I want to talk about today is depression and how depression can impact your functioning. And some of the common symptoms of depression are your focus is distracted. You have sleep problems, and typically it's the quality of your sleep goes down. You feel sad. You may have an experience called anhedonia, where things that used to give you pleasure don't give you pleasure anymore. Your appetite might change. You may gain or lose weight in terms of that. And operationally, we define that as gaining or losing more than 5% of your body weight without trying to do so could be a symptom of depression. In severe cases, you might even have suicidal ideation or thoughts about hurting yourself or hurting somebody else. Those are some classic symptoms of depression. Those symptoms oftentimes manifest in clusters to come to other type of disorders like postpartum depression or grief reaction or bipolar disorder or even clinical depression. And in very severe cases, double depression, where you have something called dysthymia, a low-grade depression, coupled with a very clinical depression. Anxiety is another major condition that we experience within the Latino church and in other groups as well. And what happens there is that your nervous system gets out of kilt a little bit. You have something in your system called the autonomic nervous response system, autonomic being automatic. So anything that operates automatically in your body is under that autonomic nervous system. We sometimes call that the fight or flight response. So when we're experiencing a fear or something that's a threat in front of us, we will get nervous, we will get anxious, our heart will begin to race, our blood pressure will go up, our pupils will dilate, we'll start to sweat because of whatever that fear is. And then afterwards, we'll hopefully calm down back to normal state. But for people that have anxiety or anxiety disorders, they don't calm down as quickly. And so they may be moving around in what I call an autonomic nervous state of arousal. So outside they look normal, inside they're trembling all the time. So it's very important to calm them down. One example might be if you've ever almost got into a car accident and you're screeching on the brake. And how does your nervous system react to that? You'll get almost an electrical charge in your body saying, wake up and focus on the threat that's before you. And hopefully you didn't hit what was before you. And then a few minutes later, you're going to have what I call a parasympathetic breath, or it's like this, thank you, Jesus, I didn't get into that accident. And that's an example or a sign that your nervous system is now gone back to equilibrium state, or you're back down to normal. Well, many people who have anxiety never get to that. So it's important to teach folks to have that parasympathetic, thank you, Jesus moment as well. So that's important to understand those. Other things that we can do to help with these anxiety and depressive symptoms is often to take medication. And that's often a quick response that a physician or psychiatrist will do to help you deal with your depression, your anxiety. But in therapy, we understand, and research suggests that it isn't just medication that can help. Long-term outcomes are best when there's a combination of possibly medication and possibly good therapy, oftentimes cognitive behavioral therapy, to change the behavior so that the person doesn't have those symptoms going forward. but medication can help. A question that I'm often asked within the Latino church is, I'm afraid to take medication because they're addictive. And I want to dispel the myth, at least with one classification of medications that are often prescribed. The most commonly prescribed medications in the world for psychiatry and psychopharmacology are a class of medications called SSRIs. SSRIs stand for selective serotonin reuptake inhibitor, antidepressants. So you may have heard of the names of these medications before: Prozac, Paxil, Zoloft, Effexor, Luvox, Cymbalta, Wellbutrin. All of them have SSRI type of components to it. And many people are afraid that if they take them, they'll get addicted. And the answer is, you won't. However, it's very important to follow the medication dosage prescribed by your psychiatrist or your physician so that you don't have bad side effects. And what they do, SSRIs, selective serotonin reuptake inhibitors, what they do is they actually allow serotonin, a neurotransmitter in your brain, just to flow more efficiently across the synapse. It doesn't produce more, it doesn't take away, it just allows for the naturally occurring serotonin in your brain to flow more efficiently. And it helps disrupt the process of reabsorption. So it just blocks it from just being wasted and just more of it to flow more efficiently. So they're actually pretty healthy medications to take, and there isn't a lot of worry in terms of addiction there. However, for anxiety, the most common type of medications prescribed are in a classification of medications called anxiolytics, and sometimes referred to as benzodiazepines. Those can have addictive properties to it, so we want to be careful when we prescribe them and when we use them in terms of taking them for anxiety. Oftentimes people will abuse them because it makes them feel good, and they work similarly to how alcohol works in the brain. And there's something called the benzodiazepine receptor complex in the brain, which helps you calm down when you take these medications. But they can be addictive, and we worry about prescribing those to people who might have addictive components to their bodies, or that they drink a lot, because you don't want to be drinking alcohol with these type of medications. And they're helpful in getting the body's autonomic nervous system to calm down. So we do want to be careful with those type of medications. Still, take them if you need them. It's much better to take a medication than to feel super anxious and feel very uncomfortable with that. But what can we do if we don't want to take medication and we don't want to do therapy, which can be an expensive and long process? Well, one of the things you can do is sleep better. Sleep has a powerful process and components to it that allows your brain to rest and to relax and to rejuvenate. All of us have had great night's sleep. And when we wake up, we just feel awesome. We feel focused. We feel energized. We can carry out the day. All of us have had a bad night's sleep where we wake up and we just want to go back to bed and stay in bed and can't focus and concentrate. But if your brain is rested, it's going to be healthier. So rest is one of the most important things you can do for your body that doesn't cost any money and shouldn't cost any time. And you should try to cultivate the environment that you sleep in to give yourself the maximum amount of sleep. And that might include cutting off coffee after a certain time, or not drinking Diet Cokes, or eating too late, or things like that. So sleep is real important. I say that because, as an example, somebody who is suicidal, or oftentimes somebody who's suicidal, has not slept very well. And when I get a suicidal patient in my office, oftentimes they're suffering and struggling. And oftentimes they've not slept for 2 or 3 or 4 days. And oftentimes one of the angles I get to get them to the hospital is, you need some rest. You need a place where you can just process, take some medication, relax, because right now you're not thinking very clearly because you've not slept very well. So that's how sleep is so important. What else can you do? Well, you can exercise. We know that cardiovascular exercise has the same potency as some antidepressant medication for mild to moderate depression. So just regular cardiovascular exercise will impact the 3 things that we talked about earlier. It'll impact how your brain uses sugar, how blood flows throughout your brain, and how oxygen is used in your brain. So just exercising regularly can help in a very positive way for those that might have depression. What are some things as believers that we can do in terms of our faith that will help us? Well, prayer is important, and the fact that we can speak to the architect of the universe and share with him our thoughts and feelings, it's real important. Another thing as a believer is forgiveness. And I often share with folks, if you forgive, and it's easy for me to say, difficult to follow through, it'll heal your brain. If you don't forgive, there's something called cortisol. It's a toxic hormone that will build up in your brain. And so as you have stress, it's a stress hormone. So if you don't forgive, you're going to walk around with toxicity built in your brain because of this cortisol buildup. So forgiveness helps to kind of cleanse your brain, if you will, of that toxic chemical. Forgiveness is important too, because it helps you speak to God a little bit more clearly and freely. If you're not forgiving, you're not freely and fully able to engage your significant other. Because how can you if your heart is torn with unforgiveness? You can't fully engage and participate with your children. How can you if your heart is torn with unforgiveness? You can't truly, fully engage with yourself and the things that you need to do if you're worried about unforgiveness. And in the end, how can you fully engage with God if your heart is mixed and torn with bitterness and unforgiveness? So forgiveness is real important. Purpose is important. All of us need to have purpose in life. So whether you're 9 years old or 90 years old, making sure that you have purpose in your daily walk is important. You need to be patient in the things that you pray for and the things that God has in your life. If you have that patience, God's timing is always perfect for you as well. Perseverance in continuing forward. I anchor to the book of Joshua regularly, and that is strength and courage, faithfulness and obedience in terms of your walk. God told Joshua, get up, dust yourself off, even though you don't feel equipped, even though you don't feel ready. You've got to lead yourself and these people to the promised land. But you've got to be strong and courageous. And the angel of the Lord told him 3 times, be strong and courageous, and that you can get to the promised land. So I think those are important concepts too. Be faithful and obedient to our spiritual walk, and be strong and courageous as we go forward, despite what's going on around us. And that doesn't mean you don't need medical help or mental health care, but oftentimes it's important to keep those in mind as you're going forward in collaboration with mental health or medical care as well. I bring the last thing to your attention, and it's a story of Florence Chadwick, famous swimmer. Florence was a swimmer in the 1950s. She decided one day to swim from the shore of California to the island of Catalina, 26 miles in the water, a marathon. And those waters are cold and they're murky and sometimes full of sharks. And she trained for a while and started one night and trained for 6 months, started at midnight and began to swim towards Catalina. Following her was a small boat and it had her mom in it, a doctor and another helper. And she swam for 8 hours straight until the dawn broke. When the dawn broke, sharks were coming around from time to time. It was freezing. She was exhausted. And then a thick fog hit off the coast of Catalina. She didn't know how close she was, but a fog had hit, and she began to panic, and she got afraid. And she couldn't see her mom anymore. She couldn't see 2 feet in front of her, and she shouted out, "Mom, I'm done. Pull me in the boat." And the mom said, "Are you sure, daughter?" And she said, "Yes, I'm exhausted, and there are sharks in the water kicking at my feet or right at my feet." And pulled her into an oar, brought her into the boat, covered her in a blanket, shivering and cold. She was terrified. But moments later, the fog lifted, and the coast of Catalina was right there. She had almost made it, but she gave up. And then she said, "I'm going to do this again." 6 months later, she tried it, and she accomplished it, despite the fact that all the things that happened to her before happened again. Coldness, murky water, exhaustion, sharks coming, thick fog in the morning. She persevered and got to the island. And I leave that message with you because I think that a lot of us feel that way from time to time. We wake up in the mornings with a thick fog over our head. What are we doing? What's going on? But it's important to keep going. It's very important to keep going. Or that we're surrounded by sharks. And sometimes we feel that way in the world. It's important to keep going. Or the water's cold or the day's cold. We're confused and we're panicky. It's important just to keep going. When we go back to the book of Joshua, chapter 1, verses 1 through 9, verse 9 pops out to me, which I think is the most important of all the verses, and that is, God didn't promise us an easy walk through the desert or through a swim through the water. But he did promise us in verse 9 that he'll always be with us. And understanding that God is with us, even in the deepest and darkest parts of our life, is an important process. That the promise is that he'll stay with us and walk us through this and get us to the promised land, I think is critically important. But that's pretty much it. Thank you so much. Thank you for hearing me out, and God bless you all, and hope you have a wonderful day.